your field of suicidology to a broader mental health scope, how do you feel the subject of mental health has been treated in a strategic policy level? Has it been emphasized in your time or not emphasized enough, especially in the global health strategies?
Well, obviously, it would be nice if there would be more emphasis and more attention and maybe also more budget for mental health and suicide prevention. And certainly researchers, and there are advocacy groups who advocate for receiving more budget, more policy attention with regards to mental health and suicide prevention. And I think one of the most important evolutions that has occurred certainly over the last decade, is that what we call people with lived experience, people who have personal experience of mental health, people have personal experience of suicidal behavior. Maybe they have been suicidal themselves or attempted suicide themselves, or maybe they have been caring for someone who has been suicidal, or they have been bereaved by suicide. The voice of those people has become much more important over the last decade. And it's a huge evolution, because in the past, when, for example, academics and researchers and clinicians would go to government and say, well, look, suicide is important and we need more budget and we need better policies to address suicide prevention and mental health prevention and treatment, then for policy level people, it was easy to discard these questions, because basically researchers were asking money to conduct research. But when people who have lived experience advocate for more research or more service delivery or better service delivery, it's difficult to discard it, because they would not ask it for themselves. They would ask it for other people who are suicidal or experiencing mental health problems, and who are experiencing finding the adequate support, the support that they need to prevent suicide or to prevent mental health problems, or to provide adequate treatment for attempted suicide or mental health issues. And so the inclusion of people with lived experience and the collaboration with people with lived experience and academics, researchers, clinicians is one of the strongest evolutions that has occurred over the last maybe 10 years in Australia, but also internationally. And I think it will help us not only to get better or maybe higher budgets for suicide prevention and mental health, but also get better policies and better programs that are targeted to the needs of people who are suicidal or are experiencing mental health problems. So it certainly will, that's the expectation, will boost effective service delivery for people who are suicidal and experiencing mental health issues.
So I come from Indonesia. I'm a medical doctor. I've worked 7 years City Hospital, ER and critical care. And we, in my time in practice, we do get people coming in after a failed attempt, and then however, the mental health support infrastructure in developing nations might not be as strong as developed nations, and it's really hard to convince like health authorities over there that mental health is actually pretty important. And it's kind of sort of regarded as something to deal with later, you know what I mean? Because like especially in Indonesia, I guess specifically, we're dealing with TB, we're dealing with a lot of other stuff that's the more primary concern of the health authorities over there. In your perspective, is that kind of approach very short-sighted or understandable, even given the nature of developing nations? If not, what is your opinion on how to change that perception that mental health is almost not really health in some kind of in some circles of health authority in developing nations?
I understand where it comes from, and maybe in many Western countries also, maybe 20, 30 years ago or 50 years ago, mental health issues and suicidal behavior, they were not important, were not regarded as real problems for society, or not even problems for common people. But I think it's important to emphasize that suicidal behavior and also mental health issues, they may not be strictly speaking an individual problem, but when someone attempts suicide, or when someone is suffering from depression or anxieties, or schizophrenia or other mental health problems, it's not only the individual itself who is affected, but it's also the people around them, the family members, who are also suffering because they live together with a person who is suicidal or has mental health problems. And it also affects their health on a long term. So when you see one person who arrives at the hospital with an attempted suicide, it's easy to say, well, this is one individual, and after a couple of days we send the individual back home, and then they must cope on their own. But that's not the end of the problem, because then the person may need follow-up treatment. And also the family members who have been caring for the suicidal person and may feel it also as a burden on their own health and mental health, may also need support to be able to continue providing support to this particular person who has attempted suicide. So it's not only one individual, but it's a whole system, maybe 5 or 10 people around them who are involved. And you could also look at not only the health and mental health impact, but also at the economic impact that it has on society, on the country as a whole, because the person who has attempted suicide has been in hospital, is a medical treatment, which is a cost to society. And the person may not be, for example, for mental health reasons, may not be able to work for a couple of days or weeks or months. Similarly to someone who has a severe depression may not be able to work for several months. So you could also see at what does it cost to society, all the mental health problems and suicidal behavior within the population, and maybe the treatment that you offer is far less costly than do not treat people at all. So it might be even on an economic basis more efficient to provide treatment to people than not to treat them. So I would certainly say that we encourage people in other countries, researchers and clinicians, to also look at what's the impact on society as a whole, and use it as an argument towards your government, towards people in policy, to really provide treatment and support for people who are suicidal and people having mental health problems, because it is cost effective.
Couple of final questions regarding like the future outlook of your field and your work, especially in a global perspective. Given the state of mental health currently, where do you think the field is headed next? Are we close to a better understanding of what affects mental health and especially suicide, which is your field? Or is it now a matter of advocacy on a global scale, informed by the academic wisdom that teaches us that mental health is something that is very important and, as you say, economically significant. Yeah.
Well, I think we need both. I think we need both. We need to continue the research to increase and improve our understanding of the risk and protective factors for suicide and suicidal behavior. But at the same time, we already know a little bit, and we already know a little bit about what is effective with regards to interventions and treatment and prevention. So in addition to continuing and improving our understanding, I think it's also important to implement what we already know about what is effective with regards to providing support people who are suicidal or people who have attempted suicide, to people who are bereaved by suicide. We need to do both at the same time. And for example, there are now in Australia, for example, initiatives starting for people who have attempted suicide to stay in so-called safe places or safe houses, which are not within the clinic, but in community, where people can stay for a couple of days with peer support. And there are already very good results from these experiments where people are treated or supported by peers, for example. And I think those kind of initiatives we need to examine further and try to find out how we can implement it on broader scale when we understand how they work and why they are beneficial for people who are suicidal, in addition to traditional treatments that we provide through clinicians and psychiatrists looking at depression and anxieties, which are also major risk factors for suicide and suicidal behavior.
Right. One last question. Do you have any specific hopes in the future regarding mental health, global health, or specifically your field? How realistically achievable is that within our lifetime? If not, what are the factors that need to change so it is achievable?
It's a difficult question, but I guess it's about a mindset. It's like a cultural change, if you want, that we must look at suicide and suicidal behavior as something that we can prevent. And of course, we will never be able to prevent all suicides and all attempted suicides, but it's about changing the attitude, about not being defeatist about it. It's the same like with the comparison is not really 100% and it may not be appropriate, but if you compare it with car accidents, for example, we also look at car accidents as something that can be prevented. And we actually do not fully accept it that there are car accidents, and we expect from policymakers and from community at large that we try to prevent car accidents. So why can we not look at suicide and suicidal behavior in a more or less similar way, as something that we know that it exists, and we know that there will be suicides and attempted suicides, but maybe we can do better to try to prevent it.
Thank you, Dr. Andriessen. This has been a very illuminating interview. I'm sure any final thoughts you want to share with the audience that wasn't necessarily asked of you in the line of questioning? Just to so the people most likely to see this are other young people that might be interested in public health and global health in general. So I guess what would you say to people like them?
Well, I would certainly if people are interested in being involved in the field of suicide prevention and mental health, I certainly would say that it's very welcome, because we need people who are working in suicide prevention, working in mental health as a researcher or as a clinician. But I think it's also important to look after yourself, after your own mental health. And because we know that also clinicians and researchers can be affected by suicide or suicidal behavior. And it's important to maintain good mental health for yourself and for people around you. And always, I say, maintain hope and positive perspectives in this work.